Hina, your mic is not working.
Let's try that again. Good morning, everyone. This is Hina Shah from the Kansas Health Institute. I'm your facilitator this morning. This is the workforce subgroup convened by the Senior Care Task Force. I know it is 9 a.m., but I'm going to give everyone a couple more minutes to join so we get to quorum. All right. All right, it looks like a few more have joined. Good morning, Haley. Would you like to wait a few more minutes for everyone to join, or would you like to go ahead and get started?
We can wait a few minutes.
Okay. Haley, we only have 4 work group members right now.
I was just looking at that.
Yeah.
I know Leanne said she messaged me that she would not be able to attend. But yeah, that's not too many.
No, and I know that Rachel Monger is going to get on for Deborah's Air.
Okay.
Jan Kimbrell, I think, wasn't going to be able to join. She had sent me a note earlier. So the only other person would be Jamie Gideon. Sean Sullivan's a content expert. So you are decent.
Well, if you feel comfortable proceeding, yeah, I didn't realize, I guess the majority of individuals that I was thinking of are probably content experts. And yeah,
Yeah, I
I'm fine
mean,
with
1, 2,
proceeding if you are.
3, 4. If we could get one more person on, I'd feel a little more comfortable. Because I think you're about 8 total, so at least you're half. Here we go. We've got Rachel on, so now you're at least 5.
Okay.
Yeah. All right. Well, again, good morning. This is Hina Shah, Senior Analyst at the Kansas Health Institute. This is the workforce subgroup convened by the Senior Care Task Force. I've got the agenda up for you today. We'll do a quick welcome, introductions. Those of you that have been part of the process, maybe a quick, couple sentences about how you're feeling about the process, successes, challenges. Then we'll go into the report. I'll go step by step through the report so that you can ratify that. Then we'll talk about preparation for the task force meeting. So volunteers to basically present the recommendations to the task force. And so we'll go through that process and then we'll adjourn. Right now, the meeting is scheduled for 90 minutes. If it's a little shorter, I will defer to the chair on what you would like to do with the remainder of the time. So again, the meeting commitments: come ready to discuss and compromise, keep remarks succinct and on topic, don't hesitate to ask clarifying questions, and I'll make sure we start and end on time. I have the vision statement up for you. I will read it just to center everyone to this meeting. The vision statement for this subgroup is to utilize a systematic approach to understand the needs of the formal and informal workforce serving seniors in the state of Kansas, while discovering these needs, creating a long-term approach with public policy recommendations to entice a workforce to return to and be retained in the senior services industry, to enable seniors and their families to have supports to make choices for their best lives in their preferred environment. So as you hear this, I will have you all go around and introduce yourselves. Thank you for those that have joined. I'll start off with your chair, Haley Ordoin. Haley, could you introduce yourself and then maybe give a sentence or two on kind of successes with the process, any challenges, feedback on the process, and then what you're looking forward to with the task force meeting?
Sure. So I'm Haley Ordoin here on behalf of Kansas Adult Care Executives, the co-chair here for this work group committee. I'm just really proud of everybody bringing their knowledge to the table to have everything at the point that we're at now. I'm just looking to kind of fine tune everything, not looking for, huge systematic changes of everything that we've worked on to this point. And I know, that not everything is going to hit every single bullet, but just coming in a respectful way to make it the best that we can to present and be a spring to launch and work from.
Thank you, Haley. Next, your vice chair, Senator Holscher.
All right, sorry about that. It took me a second there. Good morning.
Oh,
I had
finally.
I had a cat jump behind me here, so I was in the midst of trying to get that taken care of. That's, the adventures of working from home. So, good morning, everybody. I'm Senator Cindy Holscher, and I will just profess up front, I am the weakest link of this group because you all are the experts, and you know, I appreciate all the work you do and the expertise you bring to the discussion. So my job here is really to listen, to make sure that once I return back to the legislature during session, that I can bring forward your views and your experience effectively. So like I said, I just appreciate everything you do, and thank you all for being here.
Thank you. And then I'll just go in order of my screen. I see Camille next.
Good morning, Camille Russell, Long-Term Care Ombudsman. We are advocates for individuals who live in long-term care facilities in Kansas and across the country, and I'm really looking forward to just finding any and all solutions, working together, because it's going to take a lot of them to work on this project. So good to be here.
Thank you. Next I have Kelly.
Kelly Summers, I'm director of the Kansas State Nurses Association, and likewise, I'm a BSN RN. And the purpose of us being here and the Kansas State Nurses Association is to advocate on behalf of the workforce for specifically RNs, but also our mission is always to advocate on the best care for our patients and our community in Kansas. And I appreciate being here. I've made a lot of new friends and people that we will and continue to work with on public policy. Thank you.
Thank you. Next I see Rachel.
Rachel Monger. I'm the Chief Advocacy Officer with Leading Age Kansas, and I'm sitting in for my boss, Deborah Zaire, the CEO. She's out of town. She did not pass any remarks on to me, so one, apologies, but two, I assume that means great job, everyone. So I'm just here to take notes and answer any questions we might be able to. Thanks.
Thank you. Next I see Ernie.
Yes, good, yes, good morning. Finally, Ernest Cutzley, ARP Kansas Advocacy Director. And I just want to thank everyone for all their hard work across this first half of the year. It's been a long process, but a good process. We represent those 50 plus in Kansas and also just all Kansans across time, caregivers. So thank you all for everything that you do and have done on this project.
Thank you. And I see Christina.
Good morning, and I apologize for being late. I was having major connection issues. But I'm Christina Rudisell with Johnson County Community College. I'm here to represent the education aspect so that we can train new workforce. So hopefully build up our workforce so we can add more people to the workforce. And I have just been really honored to be a part of this committee. I have learned so much. And I just really appreciate having the opportunity to be involved. And I'm looking forward to seeing what kind of changes we can make for my father-in-law on the selfish side of things, because he's near and dear to my heart. So thank you.
Thank you. Did I miss any work group members? All right. We also have Connor from KLRD on, and also my colleague Emma, who will be monitoring chat as well. All right, so let's get started. I'm going to share my screen and we're going to dive right into the report. Has everyone had a chance to review the report? Yeah? All right. I'm going to go kind of page by page and see if you guys have any edits. And if you do, I will change them. But have you had a chance to look at kind of experts that had presented to you? And that's our job to make sure they were all there, but anything that you saw missing. All right, report overview. Any questions or concerns about what was presented in the report overview? All right, vision statements that you guys have been seeing kind of every meeting, so verbatim from what's on your agendas. And then this is the figure that shows all of the recommendations by tier. It's not just the workforce ones, it's every single one. So know that everything is hyperlinked. I don't know if many of you saw, but this is an interactive report where all of the recommendations have links to them. So I'll show you kind of a few different features. To look at only your recommendations, the best place to go is Appendix C. And then you can see them right at the workforce one. And so you can see tier 1, and then go down to tier 2, and then go to tier 3. All right. And then know that you had some cross-cutting ones, and so the cross-cutting ones are reflected under the cross-cutting One. All right, so let's go to your recommendations. So I'll go to the cross-cutting ones first, just to make sure that we capture them appropriately. And so the only one that you had was the Rural Healthcare Coalition. Because of the way that this group was kind of categorizing recommendations based on training, retention, and recruitment, that's kind of what has been put next to the tier so that you have a focus on that. Any edits or changes to this language? Did we capture the rationale appropriately? And collaborators, anything else to add? Any other performance indicators? All right. The other thing I want to point you to is kind of these little hyperlinks as well. You can always make it down to Appendix C, and you can always make it up to that big Figure 1 list. So have fun playing around with those. All right, so no changes there. I'm going to go straight to your recommendations then.
I have a question. I'm
Yeah,
so
go ahead. Yeah.
stuck up there on the rule thing.
Mm-hmm.
It said the key collaborators, and I saw critical access hospitals, KHA, AAAs, and peak. Why aren't the long-term care, the senior care people in that?
It's something that could be added if you wanted.
I guess that I think the intent was that providers was where that was included, Rachel.
Oh, just providers? Okay. See,
Are
that's
you meaning like the associations?
no, not necessarily associations, but just I didn't see on there, actual nursing homes or home health or anything like that.
So
Yeah, well,
providers is inclusive of that. Thank you,
okay.
Haley.
Sorry.
Excuse me, this is Camille Russell, State Long-Term Care Ombudsman. Is there somewhere in this report that we could have that defined? Because I believe we did that in all of our groups and thought the same.
Yeah.
The two groups that I was in, at least, yeah.
Why don't we could define that up front or have a quick glossary as well. So I'm going to highlight that for now. And we can go in and maybe do a glossary or definitions list. Thank you. Any other edits? Appreciate that clarification. All right, so let's jump down to this. Any changes or edits to kind of the front matter, setting the stage? Data shown. All right. So then I'm going to go straight through. I'm just going to go recommendation by recommendation. Any edits to 9.1 on reimbursement rates? Again, take a look at the rationale, key collaborators. Go ahead, Kelly.
Could you tell me, when I'm looking at this and it says state of Kansas, who would be the determiner on rate of pay for something like this? I mean, is that what we're looking at right now? Is that to increase pay for staff, let's say?
So your leads are KDADs, the legislature, and providers. So the leads would be the ones that would be spearheading this initiative and making it actionable.
Currently, I'm pretty sure that it is KDAS that does, I mean, legislation sets some of the parameters of the approval of the overall budget, but KDAS does, the rate methodology and such that, we mentioned in that portion. So.
Okay, it's so that's not just for CNAs. We're talking, let's say, a CNA, an LPN, an RN. KDADs would make that recommendation on the rate of pay.
Hina, do you mind if I reply?
No, please.
That? So
please.
My understanding of the intent with this is that the research is done to conduct the reimbursement rates to the provider that is then the wage pass through. Like, what is the true actual cost that we need to be reimbursed on the provider side so that we can adequately pay the wage scale rates that are really required, needed, necessary for our workforce to retain, to recruit in that manner, not
And-
only on the like long-term care, senior living, but also on the HCBS and home service side.
So where is this research available for us to review?
A way of research would need to be conducted, right, to review
Yeah.
the
Oh, so
methodology.
we're waiting for the research to make these for KDADs to make the recommendations.
We're wanting to conduct the research to get true, accurate costs and assessments of what the needs are now, because we have the systems in place, we have the methodology in place, but the kind of presumptive assumption here is that it's antiquated, it doesn't meet the needs, we don't have a good system that truly accurately captures the rates necessary now, and also a process to continue with increases in the future. Because some of these programs only get rate increases when legislation passes it. Like I know on the HCBS side,
Right.
some of them, haven't changed for years.
Right.
So we're
I
looking
just
to
know
create that
that,
stability.
like, if we look at long-term care homes, there's a huge discrepancy, obviously, in what one home pays versus another regarding starting pay, even if you're going county to county. And so I don't know who it is that is performing the research. I would like to know what it is that we're measuring, who's performing the research, where this information is being obtained, so that we make sure as a work group that we're getting all of the adequate information, not just for the state of Kansas, but what's happening statewide within our country too.
I would add, well, a couple of things.
Yeah.
Yeah, they would have to bring in experts to see how. I'm sure we're not the only state that's done something like this. It's particularly hard outside of a nursing home. Nursing homes are the only people in the state that do full cost reporting when it comes to Medicaid. So we account for every penny spent, and that's publicly available information. Other providers don't do that. And I think also why you have to bring in experts too is when you talk about pay discrepancy from county to county or provider to provider. One, I mean, cost of living is different from county to county, but you have to factor in what kind of population the nursing home is serving. We have members that can and do pay a whole lot more than others because they're primarily private pay, or versus someone who's primarily Medicaid in their population. So that's why I think you'd have to bring in experts, because you would really have to account for all of those types of things, along with acuity and care.
Okay.
What I'm
I just
hearing,
wanted to check because, because I always want to be quite honest from the workforce side of it. And that is that when you're talking about workforce, they probably don't care how you're being reimbursed sometimes. And they're looking at their own personal rate of pay. And so that's where I was wondering where this conversation was and who's doing the research to understand. And thank you, Haley, because I know we've all talked about this before too. But we have to remember this from the workforce side too, because this is the intent. So
go ahead, Haley. Did you have another comment?
Yeah, I was just gonna reply to Kelly when you said, that they may not care about the reimbursement. That's kind of a frustration on provider side, because that's where it's all based off of is
Right.
like Rachel said, the cost report, our cost, it doesn't, and providers have kind of advocated that it doesn't accurately capture our true cost of services. And, a provider whose Medicaid reimbursement per day per person is $150 versus over here $250. Yeah, you're going to have a huge rate scale difference of what can be paid. So on the provider side, trying to accurately capture that, doing this research of what it truly would cost is going to help make the wage scale per facility, maybe there could be a process by which that's done. Right now, it's kind of a little bit on the provider side of what the acuity level is. Like Rachel said, that passes through to the Medicaid reimbursement rate. And, you know, again, with this, maybe through the research, that is something that we could conduct to where there is some sort of mathematical wizard better than I who would know how to calculate that so it truly captures, you know, work level, staffing ratios versus pay.
Well, and when we talking about staffing ratios, obviously we're not where we should be. But I also would say that staffing ratios are based on acuity, experience. Are you a new grad? Are you seasoned? So when we're looking at these, I mean, I think there's a lot of components. Well, I don't think, I know there's a lot of components into this type of research that will need to happen, because when I have these conversations all the time, just had one yesterday, and we talk about staffing and safe staffing, which this is what it is part of it right now too, is that it's not easy. It's a lot of research and there's a lot of components that fall into it, as you all know. And so I just want to make sure that when we start doing this research, whoever it is, that we know what's being measured beforehand, and so that we have input on concerns that anybody may have on what isn't being measured in that
So
research.
Kelly, the best place, if I'm hearing correctly, to capture that is between your action lead and your key collaborators. So if this recommendation is accepted by the task force as something that they want to present to the legislature, the group wants to make sure that the action lead and the key collaborators have everyone that want to be at the table to start implementing the recommendation. And so if you see anyone missing, that is really the place to put them.
Okay,
Is
thank
there
you.
anyone else that you would like to add to the key collaborator list, knowing that? All right, then I'm going to move
Well,
us along.
I'm going
Oh,
to add KSNA, and that is because we also have access to studies for every single solitary state, because we stay in communication with all of the directors. We also have the American Nurses Association and the American Nurses Foundation, along with many others, that has done this research too.
thank you. Any objections to adding KSNA to the key collaborators?
I think it needs to be all inclusive if you're going to do that with,
Right.
Other associations as well?
yes, yeah.
Um,
I agree.
And I don't know if that, again, can be kind of like we had said in the glossary, where providers is all inclusive, that we put down, associations is, you know, further defined.
Sure, we can do
I
that.
agree. Thank you.
This is Camille, the state long-term care ombudsman. And
Mhm.
I looked at key collaborators and thought I'm going to be quiet, because we actually, a provision of our program is that we can do quote unquote lobbying without being identified as a lobbyist. So I just assumed that could be part of that. And my hope is, and we're looking at this too, is that we also at the end at least put in an element that once we realize that we do probably need, and what we need to be increased, is that we also have measures, and I'm just saying this, measures in there that make sure that any increases actually are going to the workforce directly. So
Yep.
Good point. Thank you.
Are you comfortable with the key performance indicators then, or did you have any additions to that?
Would it be appropriate then under key collaborators, sorry, and I don't mean to move us back, instead of
No, you're
lobbying
fine.
groups, to put advocacy groups? Does that change the realm of capture, Camille?
I think it does make it more inclusive of others, because we can do that without it without problem, but some advocacy groups that may limit it, yes.
Okay,
Is everyone
And
comfortable with this
likewise,
change?
us too, Camille.
thank you.
Okay. Any other edits to the key performance indicators? All right. Knowing that, I want to give you sufficient time to look at each recommendation. For the task force meeting at the end of August, is there a volunteer that would like to relay this recommendation, present this recommendation to the task force? Everything defaults to Haley, by the way.
That's why I wasn't going to say a single thing, because I knew where it's going to fall.
But would anyone else like to present this recommendation?
Can you help me understand what that means. What does that entail?
Sure. So presenting the recommendation would be one, stating the recommendation, providing kind of a 30-second brief update on the rationale. They can read the rest of it, but it's really giving the rationale some context for them and the recommendation language itself. And then remember that strategic importance means that it'll take, 3 to 5 years, but to start the process, laying the foundation the first, second year. So maybe doing the research and such, and then it would be implemented kind of in year 3.
I think I would be of better use when it comes to the instructor stuff, more
Okay.
so than the workforce.
All right. Haley, I'm going to put you for now, unless
That's fine.
someone
I
else
really
wants.
wouldn't mind because I feel comfortable
Yeah.
advocating for the long-term care sector and the HCBS also.
Terrific. All right. I'm going to move us on to the next one then. The next one is recommendation 9.2. So that Connect to Care jobs platform. Any edits to this? Besides a grammatical thing I found. And again, take a look at those action leads, key collaborators, and your performance indicators. Volunteers
Just
for
have a
this?
question on definition. Sorry. On key performance indicators, what does staffing levels mean? I've never heard that used.
So I think it's looking at some of those safe staffing metrics that were discussed. And so looking at making sure there's appropriate and safe staffing.
So could we just say safe staffing instead of staffing levels?
You want to add the word safe and appropriate, or safe staffing levels? What's the language that's typically used?
We don't use staffing levels as far as providers and we wouldn't know what that meant. So I just want to,
But safe staffing makes sense.
yes, absolutely.
Okay.
That's the catch all for us.
Is everyone comfortable with that edit? All right. Okay. Who wants to present this one?
This is Camille. I'm sorry, this is Camille, State Long-Term Care Ombudsman. And I think under key collaborators, something that gets left out sometimes in things we're doing still, but I think the managed care organizations actually already may be trying to do something with this. I feel like they might be a collaborator in this. So,
Any objections to adding them? Okay, seeing none. Any other edits? All right. Who wants to present this one?
I'm going to ask, and I know she's not here, so I'm not going to volunteer her, but I was actually thinking Jan on this one might have been
Okay.
appropriate for this.
Okay. I can ask her. I'll make sure to send her a note. She did apologize. I think she was driving or in transit for this meeting, so I can follow up with her.
I think it's very appropriate to volunteer people who aren't here. That's
Appreciate that, Senator.
Legislation, right?
That's what happens if you don't show up. You get volunteered for stuff.
Appreciate it. All right, we're going to move on to workforce incentives and benefits. Take a look at this recommendation, rationale, and then I'll take a look at the action leads and key collaborators. Any edits on this? So I know that you have your 3 agencies under action lead and key collaborators. Were there any other collaborators that you wanted to consider adding? are comfortable with this so far.
Do we need to have, for the fact that we're doing it, some of these on-site daycares, to have actual providers that would be hosting these on-site daycares for key collaborators? I'm just looking at like ease of implementation,
Mm-hmm.
insight.
So is this childcare providers that you would want to hone in on, or both?
I think both, quite honestly, because you're going to have a component of the people able that will be conducting it, but
Mhm.
also the host site, so to speak.
Mm-hmm.
Is there a agency or an advocacy group for childcare providers? Is there anything like that?
I think it's KDHE oversees it and does the inspections.
Okay.
Of
KDG does the
daycare site.
licensing, yeah, and
I'm
they're part of
completely
the.
ignorant on that
Licensing done
process.
through some of the health agencies too, like Shawnee County, I think, does their own.
Hmm.
You would go
So
ahead.
when you say providers, you're including CNAs, LPNs, and RNs in this to just when we talk about incentives and benefits.
I'm talking about what my intention was like the host site, like if we're going to have these in nursing homes, assisted livings, what have you, that is included because they're going to have to implement it within their facilities.
Do you want me to be specific then? Host site providers?
That was my intent.
Yeah, 'cause the intention is that it benefits the CNAs, the nurses,
Right.
etc., but it's their employer that would have to host it. So
Right.
they're really taking on the legal and the expense.
Mm-hmm.
So that's the rationale, really.
So this is Camille, State Long-Term Care Ombudsman, and there are facilities that have done this or been doing this. So, getting their perspective of how that didn't work. Maybe somebody who did it and it didn't work would be appropriate to find out what what didn't work.
Yeah.
So yeah.
I would always like to know from staff if that, when you're saying that exists, Camille, I would like to know from staff if it was beneficial for them. Like, would they even utilize it as much as we were hoping they would?
And you could also think about it from an indicator too. If you wanted, you could survey staff to see if the benefit is utilized. Would you want to add that utilization of benefit to the KPIs?
I would. I'd like to know this. So we're not putting out a cost that is not needed.
Yeah. All right. Any other changes? And who would like to present this recommendation? Or who would you like to volunteer as well? You're allowed to. You guys are chairs.
I think I'm going to volunteer Deborah for this because she's not here, one. And two, those are leading age Kansas buildings that have done the daycare
Oh,
site.
terrific.
Be a good perspective.
Okay. All right. Any objections? Otherwise, I'm going to keep us going. All right. 9.4 workforce tax credit. Take a look at this one. And the next two, workforce and caregiver tax credit, are pretty similar. One's for the workforce, one's for the caregiver, though. So any changes to 9.4? Any other collaborators? All right, hearing none. Would someone like to volunteer for this recommendation?
I'm out of town, so that's why I haven't
I
piped
was
up.
just going to volunteer you, Kelly.
Girl, I know you were. I knew it was coming. I knew it was coming, but I won't be here in person, so I'll be out of state for work.
Would Jan be appropriate again?
I will do 9.4 and 9.5.
Oh, there we go. Thanks, Ernie.
Thanks, Ernie.
I'm not on
I should-
camera. So.
When are we presenting?
What happened?
August 24th and 25th. Is that
Connor,
right?
can you? Yeah, and I'm going to defer to Connor to make sure those are actually set in stone now.
I just, before I volunteer for anything, I should probably make sure that I can.
Hmm.
So the 24th and 25th of August?
Yeah, those are set in stone. So those are our dates. Yep.
And I think I think the workforce group presentations are pretty early on, correct, on the 24th?
Yeah, we're still putting the agenda together, but we can move around the work groups. So workforce can go first if need be.
So it would be like the 24th morning or early afternoon.
Yeah, likely before lunchtime, I would say.
Okay. All right. Take a look at the caregiver tax credit too now. Thank you, Connor. See if there's any edits or changes to that. And then I'll scroll down to the key collaborators similar to the last one. And then you do have utilization of the benefit, those enrolled in it. All right, next one, 9.6, cross-sector partnerships. Take a look at this. Let me know if you have any edits. Yeah, sorry. This is your innovation one. Any edits to this? Any other key collaborators to add in? Here's one, if we want consistency, would you like me to replace kind of long-term care assisted living adult care homes with providers?
This is Camille, State Long-Term Care Ombudsman. That would seem appropriate. And I'm looking here, somehow I'd like to be ability to be included in the key collaborators list from the Ombudsman's office. We have gotten more and more calls from staff, and we're resident advocates, but their staff are calling us with their needs based on the inability to support the residents appropriately. So I think we would have a place there for that innovation.
Is that the appropriate acronym?
That's fine.
Okay.
I volunteer Camille to present this.
Camille, are you okay with that?
I will do it. Yeah.
Okay.
Words right out of my mouth.
It's okay. Christina said she was going to do 9.7, right? All right, take a look at 9.7 now. Any edits to the recommendation or the rationale? And then I'll keep us moving.
I think Christine is completely appropriate to present this.
The only thing I would like to add is on our bullet for ensure adequate pay, I think that I don't want it to be just CNA, CMA, and HHA. I think we need to just say for all nursing. Does that, well, I guess we do say that. Never mind. I just wasn't reading it right. I apologize. Disregard my statement.
I do think I agree with you when you brought that up, because I was thinking the same thing, Christina. I was going to go after you with the same thing, but I would like to see in part of this that we're spelling out LPNs and RNs and not just saying nursing, because what are the changes that CMA is going to make, and we need to make sure that we're looking at both different levels of nursing.
So would you like to add in RN, LPN?
Healthcare professionals? I was thinking there was somewhere where we listed it as healthcare professionals and then define that out, because technically you could be talking about I know in other states there's issues with nursing home administrators being able to test and dietitians being able to test. So that could be all inclusive with healthcare professionals and include RN, LPN, ARNP, CNA, CMA, all.
Thoughts on that?
Well, you
Anyone?
have including but not limited to, which I think is good.
I just made that modification. I don't know if
Yeah,
that was
I like it. So
sufficient.
Yeah,
that was my only request. So
I think that's
Would-
perfect, Tina.
So remove the RN, LPN, APRN, and just keep it like that?
Yes. Because that way we can, and I can define that
Right.
better when I speak too. This is not just about, but it's all direct workforce. So
And then Haley, I'm hearing to have a definition for healthcare professionals, or is it the direct care workforce that you want spelled out?
I think direct care workforce could be spelled out.
Okay. And you're defining direct care workforce as RNs, LPNs, APRNs, CNAs, CMAs, HHAs,
mhm.
there's tons of definitions already out there for
right? We'll just grab one of
easy.
those.
Yeah, it's pretty easy.
Yeah. Okay. All right. Then if we keep going, action lead, key collaborators, and indicators. Take a look at that. Let me know if you have any edits.
I do think somebody in education needs to be on that. So
Aside from the Board of Regents, so
yes, oh, well, we have KSBN, but I would say specifically like education committee with KSBN because they're the ones that focus on all the education. We're the ones that write all the regs for.
Well, let me throw in too, though, when this discussion happened, Christina, and the rest of the group, is that KSBN, the education committee, is not the board, and the board really felt that they should be a part of this process too. And
Right. No, I
yeah,
know. I'm on the education committee.
yeah, I know
But-
you are. That's what, yeah. But
But
talking to the board.
right.
have
no.
both is what I'm hearing.
The president of the education committee is on the board.
Yes.
So that individual is on the board. So either way, as long as that individual, whomever, because Patty's stepping down, her term just ended in
Right.
June. So whoever takes that position should probably be. But we also need somebody in like one of us that does this, like
Yeah,
somebody from
that's what I
community
want.
college
too.
or something like that.
Could you be more specific on education committee? I wouldn't want someone to think that's the legislative committee.
Oh no, yes, I'm sorry.
Are
It's
those the like you're talking like the community colleges or the universities that host these training? So education host?
So we
Yeah, I
have
mean-
course host programs in here.
Is that what we're talking about when we say that? I can't remember. I know I was here for that day, but I can't remember.
So I know that you wanted to be inclusive of those that actually develop the programs.
Yeah.
Yeah, because we did have the university just spelled out, and that's where I think that was the
Right.
intent. But if it's not clearly defined through course host
Yeah.
programs, then maybe we need
Um,
to.
What about educational host programs? That way it's not just because like we call our the nursing as a whole is considered a nursing program, whereas CNA, CMA, HHA, those are courses. Does that make sense?
Mhm.
So it could be misconstrued if they don't, if they weren't part of the conversation. I mean, I was part of the conversation and I misunderstood it. So yeah, I think we could define that a little better.
Is education host programs better?
That makes more sense to me because that tells me that if I wanted to be involved, I could be, which I probably would want to be, knowing me.
You should be, Christina. I had a question too, because if you're going to talk about LPNs to teach CNA courses, opportunities for LPNs under general supervision, you don't have general supervision of an RN per KSBN guidelines. Because
It's actually, that legislation's already passed, Kelly.
no, I'm talking about the definition of who it is providing general supervision. If
Oh,
that's all.
okay.
No,
Yeah.
I know that.
Yeah,
But
Tina,
yeah.
the current regulations state that, so you could probably just copy and paste it.
Yeah, because I'm on that committee too. So it's just
So I'm
we have
hearing
to
I need
remember
to
that
edit the
general,
first sentence. Is that what I'm hearing?
please.
Okay. All right. That's what I'm updating, correct? For the new regs? All right. Any other edits? All right. All right, next one. 5-year career path plan. This is the really long 5-year plan with lots of little action steps and collaborators kind of in the recommendation. Thinking through promotion as well. And so I know you have a list of a lot of people in here. Those are all captured down here as well. Anyone that you could think of as you were looking through. Here, let me go back up though. You've had time to look at the recommendation, so let's look at rationale, and the lead still makes sense, and then I'll go down to the indicators. Anything else you want added for context? All right, take a look at the indicators. Any other edits to that? And then volunteers for that. I will say the initial recommendation, based on memory, I think was submitted by Jan. But are there any volunteers that would like to present this?
I can.
Okay.
I feel bad. We've already volunteered Jan twice.
I think just once.
Oh, did we? Oh, okay.
Yeah, only once. Ernie stepped in for the other one. All right, the next one is identify future workforce. So this is your supply pipeline through volunteering. Any edits to the recommendation? Again, really thinking through different ways of doing that. There are programs in place already, so you're leveraging those opportunities, continuing to nurture them. Any other collaborators or leads? And the action lead being the state legislature is so that these volunteer, it can be a more comprehensive statewide program. Correct? Okay. All right. Any other performance indicators? And who wants to volunteer for this one?
You know, I would volunteer for this one if no one else is direly passionate.
I'm not hearing or seeing any other faces, so it's all yours, Haley. All right. This is your last one. Eliminate barriers to workforce entry. So this is the research. Well, it's acting upon the research. So the research is available. It's acting upon it. And also as suggested by the work group, we link this to the Rural Healthcare Coalition that would use the data and kind of act upon it. So take a look at rationale, take a look at the lead, collaborators, anything else to add?
I would request that somebody from KS&A be on this too, as we're already doing work regarding this piece. I would hate for it to be redundant.
Do you want all associations generally or specifically KSNA?
I'm just putting KS&A there because specifically KS&A is doing work regarding this. I mean, we
Okay.
just are getting ready to put out a statement regarding this piece from ANA. The work I did last June when I couldn't attend the meeting.
Okay.
This meeting.
To the group, are you comfortable with only adding KSNA, or would you like to make it more general with all associations?
It already says Senior Care Association, so I mean, you could just put associations. I don't think that.
Well, I'm not a senior care association. That's why on
Right.
my
So if we
part,
just put associations, it would incorporate everyone.
but it wouldn't
Okay.
incorporate our data. I just want to make it clear that if it's not on there, that it would not incorporate all of the studies and information we have.
You'd be bringing that though as
Yeah,
a
you
key
would be.
collaborator.
Yeah,
Pardon me?
you'd be one of the
You'd-
association, so you'd bring in the data.
Okay,
Yeah,
I didn't
you'd be
know that
bringing
there
that.
was a definition for associations. Thank you.
That's what we talked about at 9.1, that both providers and associations will be defined in the front of the report so that whenever they are brought in as a key collaborator, everyone understands what that means.
I probably missed, that's probably in the last meeting. So, okay, thank you.
If no one wants to volunteer, I can volunteer Deborah for this one. Unless someone
Any
else
other
really
takers?
wants it.
All right, it sounds like Deborah it is. Thank you. All right, that's all your recommendations. We have volunteers. So based on the conversation we've had, I've been making edits as I go. We'll make sure those two definitions are in there for providers and associations. So that is made clear across the report. Feedback on kind of seeing all of the other recommendations and how workforce fit into that. We can pop back up to or down to Appendix C. Any other thoughts or comments on kind of what you saw in the Tier 1 recommendations? Workforce recommendations seemed appropriately falling into each tier as you reviewed them across all of the recommendations. Did you see any redundancy in other recommendations that should be caught at this time? That was something that the chairs wanted to make sure that we didn't have as much redundancy across.
Could you possibly go back to the recommendation 8.2, one-time only service caps? I don't recall that one
Mm-hmm.
in trying to review it all.
Sure. Okay.
And I want to make sure see how that one laps with our research one for rates.
Mm-hmm.
And I'm sorry if you guys can hear my chicks in the background. We became the chicken family a couple weeks ago. So my apologies.
We don't hear them. You're okay.
Okay.
This is Camille, and I may not have this right, but my memory was that lifetime cap is guided by the $7,500 is guided by Medicaid rules, federal rules. So it would be state general funds that would have to increase that, I believe.
Unless there's some state plan amendment that could do it. I'm not sure.
Yeah, just
To answer your question though, Hina, I don't think this I think this is appropriate, and I don't think we need to make any changes to ours because this is talking about,
Mhm.
exemption processes, and we're specifically talking about increasing funding so that they can pay workforce better.
Yep.
So,
But Camille, you can bring that up during tomorrow morning for work groupie if you want edits to this.
I don't think
Right.
I'm on that one, but thank you.
I had put this on an individual paper, but I had a question, and that was, do we have anything in there, and my apologies, I need to review some of this, regarding what funding the state is going to provide through public policy to fund certain programs, state programs better for people to obtain certifications and degrees, be able to afford that continuing education, because otherwise I don't think we're going to grow the workforce like we would like to. And the reason I say this is because, going back to school, if you're looking at a single parent, something like that, it's not affordable to go back to school and raise families. And I really want to, as part of what KSNA and ANA are working on, is diversity within CNAs, LPNs, and RNs. So I'm just throwing that out there because I don't see yet where that's really tackling some of the big issues of why people are not moving forward into this arena and this profession.
I feel like that may have been discussed in the 5-year
Yeah.
career
That's why I'm
advancement plan.
asking.
Yeah, I believe we did touch on some of that in there.
Because when I was in DC last month, I mean, that was a huge topic for us, is diversity and care providers right now too, and what we can be doing legislative on a national state level to expand our workforce, but also making sure there is the diversity that is needed in Kansas, and to keep so that we are finding workforce also that's going to keep their community roots established too.
the cost of education is a big issue.
Right.
However, I will say that one of the biggest issues there is in people going for nursing degrees or anything like that is actually the admission testing.
Well, yeah, that's
So
part of it too.
the
Yes.
because admission tests are predominantly middle class Caucasian. It's geared to that.
Right.
And so like I know that I did a 5-year retroactive study
Mhm.
specifically on that, and we removed the admission test. We had a 90% Caucasian population in our program prior to me making that decision. And when I did my study and saw the data, we removed the admission test, and now I have a 48% Caucasian. And everything, one graduation class, we had 13 different countries represented. So I think I mean, yes, tuition is an issue. I'm not saying it's not, unless you could ask.
Oh, no, I was just
But
throwing out that as an example because
yeah,
diversity falls in so many categories. And I'm glad you brought that up because this is something I've been doing every month too, Christine. And I think you and I are both on the same page when we talk about all of the roadblocks out there.
yeah.
There's so
So
many, so
I
many.
think that's why a 5-year comprehensive
Mhm.
career path plan was proposed. And this is strategically important because it'll take a year to really get all of that sound research, the plan started, everyone to talk about it, write the plan, and then maybe start implementing it between years 3 to 5,
yeah,
if everyone's comfortable with that.
for sure.
And it sounds like Christine has done research. We've done research. Like there's already a
Mhm.
lot of research that already
Right.
exists
And
too.
there's a big list of collaborators under this one.
Right.
So it'll be
Yeah.
a lot of collaboration to put that plan together as well.
That's great. That's great. Good to hear.
This is
Okay.
Camille, and I don't want to everything that they've said. I look forward to that innovation piece that that we have, because I have felt a little bit I don't know the words for it, but our recommendations are good ones. I can back every single one of these recommendations, but I feel like we really have only scratched the surface of what really needs to be looked at for us to
Oh, yeah.
address our workforce issues. And I think we're remiss in thinking that this is going to fix anything in and of itself. So all of those things that are brought up are real, and hopefully we'll continue to work forward on this.
Well,
Thank you,
Hina,
Camille.
that brings up a question, kind of like where does this go from here? Like, I mean, I know we have the recommendations, I know we go to legislation, but like, is the Senior Care Task Force intent to be something kind of rolling and ongoing that is kind of a constant in work to where we're constantly, you know, reviewing this, monitoring the implementation, new recommendations?
So I'm going to go back to your tier 1 recommendations. So immediate process is the task force convened these work groups to really dig in, study, come up with a set of recommendations. At the Senior Care Task Force meeting, the task force as a whole will review all of these recommendations. And as a task force, those members will either adopt the recommendations, they might amend the recommendations, they may remove some recommendations. That is up to the task force as a whole. So as the subgroup during your presentations, it's really giving them a sound understanding of the intention behind the recommendation and the recommendation itself. And then afterwards, as far as longevity, if you I would defer to Connor and the task force itself, but sometimes task forces stay, sometimes they don't. You do have a state advisory council that is a recommendation in here. And so sometimes these councils, advisory groups end up taking some of this work. You also have all of your leads that you have talked about. So KDADS is a big lead actually. And I know Lacey isn't on the phone right now, but they, you know, as a state agency, they also can take a look at this list as well. So, but for immediate process, it's really the work group presenting to the task force adopting, amending, or removing recommendations, and that's sent to the legislature after. So the report will be sent to the legislature. And so that's why all of your vice chairs are legislators who have been participating on the work group. And then you'll also have the task force leadership who are also legislators. And so giving them an understanding of this. And so one thing to make sure with this report is each of the recommendations could be picked up and stand alone so that the recommendation is understood, the rationale is understood, kind of what the benefits are, those leads and collaborators. That's why those boxes were made so that anyone picking up the recommendation, whether it's at the task force or maybe later, you know, during legislative session, they had a full understanding of what to do with that recommendation. And then anything that requires state legislation, so any place you had that lead a state legislature, if the task force adopts and puts that into their report to the legislature, now the legislature can consider that. And so then it would go through the drafting. It would either be a budget, you know, or a bill, whatever mechanism is
I would
required to
bring
also
it
implement.
just say
because I want to make sure we don't, because there are some of us who are working on public policy right now already regarding some of these aspects. So I would just throw that out there. But I want to also say and expand on what Camille said. This touches a very surface issue, and we continue to have really honest conversations that maybe there's things that nobody wants to hear, but there are deep, deep roots with the workforce on why things are where they are today. And we have to have those honest conversations. And sometimes I feel like I can be the bad guy sometime, but it's honest communication that comes from the workforce. It's surely not me. These are conversations that I have every day, every single week. And it's quite frustrating because I hear a lot and it goes nowhere. And it's been going on for years and years and years. And I have to say this, I think this is a battle that the long-term care industry can say it's always been there too. This isn't a new topic. It just was made worse by COVID. And so I do think we need to get into some of those really big concerns moving forward too, or this is just going to gloss over and those issues will continue. So I'm saying that just because I think we all need to understand that, being one that does talk to everybody out there, including people who have worked in long-term care, and that includes CNAs.
Yeah, I think you're muted.
Sorry, just to kind of bring you back to this recommendation, as I remember this conversation earlier, to eliminate barriers to workforce entry, really digging into that was one thing that the group had discussed at that point. And so while your recommendations are more holistic, and as you've mentioned, at the surface level, I think some of these that you have put in, your intention during implementation is to have those tough conversations.
Yeah, we've all got to start somewhere. And I think these are at least putting focus on the topic. And that's kind of why I was asking what the intent is of kind of how this funnels, because it will be in there with those key collaborators and innovators and
right.
Leads, that this is where, you funnel into it even more. And that's where bringing that up is highly relevant. But at least we're introducing to people that may not know or not know otherwise, we got to start somewhere.
No, and I agree with you, Haley. And I was kind of expanding on yours too, that we want to make sure the ball isn't dropped or dropped too much, that we're not continuing to get that work going and continuing the work. So I completely agree with you on that piece too, because that's always a fear of mine, that we have a task force established and then it ends, and then where does everything go that we've worked on so far and want to continue to work on?
And I'm not sure, Connor, if KLRD has done this, but for past task forces, I know that at least some of the leadership for this task force was relying heavily on the Child Welfare System task force and kind of work done under that group. Is there a crosswalk or anything available of kind of past task forces and recommendations that have been put forth? I know the Special Committee on Modernization and reform of the behavioral health system has done a little bit of a crosswalk there as well, but maybe that could help this group think about kind of direction of task force and longevity as well.
Yeah, Hina, the last time we did a crosswalk was for mental health last year. And we the recommendations from Child Welfare Task Force, if I'm remembering correctly. We could provide something at the August meeting that does sort of a mini crosswalk if you'd like. But to Haley's other question, statutorily, this task force is required to produce a report by 2023 to the 2023 legislature, as you mentioned, Hina. And then statutorily, it does sunset in 2023 during the legislative session. So that would be the end officially of this task force. But of course, its recommendations could be used later on for other cross bodies and task forces.
Thank you for that clarity, Connor. Any other questions? I'm going to keep going through just kind of the tier 2. If there's any other ones that you wanted to look at to make sure they didn't overlap. And then tier 3 is your last one. All right, well, we are at about 10:15. Any other last questions, comments, concerns, anything else before this is your last meeting? The next time you will see each other will be at the task force meeting. And Connor, that will be available both remotely and in person, correct?
Hina, if there is a member of the task force who wants to attend virtually, if they could just email me first so we can talk about arrangements, that would be preferred.
Terrific. So those of you that have volunteered today, will you all be in person in Topeka? Would someone need virtual access?
Mr. Ernie, and we'd probably be virtual, please.
Okay. And we'll
I'll be
compile
in
this for you,
person.
Connor. All
Great.
right.
Thank you, Hina.
Thank you. So I'm hearing Ernie will be virtual, but others will be in person.
Can you remind me what day Deborah would be presenting?
It would be on the 24th. So that is Wednesday, the 24th.
Thank you.
And before lunch. So kind of blocking the morning. Any other questions? Well, it has been a pleasure working with you. If you have any feedback for kind of the process or the team, feel free to email myself or Michelle, and we will definitely keep that in mind for the next time. All right. Well, thank you all. Take care.
Thank you, Hina and
Thank
group
you.
for everything. This has been a huge learning experience.
So much. Thank you, everybody. I've learned a lot.
Yep.
And thank you, Hina. You're an amazing person. Thank you for keeping us all straight.
All of that too, yes. Keeping us going down the road.